I'll be joined by Dr. Perpetua, whom will be in Abuja Studios. How are you doing, Perpetua, if you can hear me?
Yes, I can hear you. Good afternoon.
Very well, good afternoon. I want to continue this conversation and talk about COVID and what sort of effects that COVID has had on malaria, because a lot of people started interchanging or using both, or it's COVID, it's malaria. Do you think people still take malaria seriously, is what I want to know.
Yeah, thank you very much for your question. In terms of the impact of COVID-19 on malaria, particularly for Nigeria, we found that initially at the peak of the pandemic last year, there was a decrease in the number of people going to the health facilities to seek care for fever in particular, because of the symptoms that are related, symptoms between malaria and COVID-19, which is fever. And so when people had fever, they were afraid to go to health facilities because they didn't want to be told that they had COVID-19. At the same time, the health workers initially were also skeptical about attending to patients who presented with fever, because they were also afraid to contract COVID-19 initially, when they didn't have the personal protective equipment sufficient enough to protect themselves to ensure that they were not in any danger of contracting COVID. So that impacted on health-seeking behavior of people. People resorted to seeking care in community level from pharmacy, or resorting to self-medication and all that. But eventually, over the months, we've kind of stabilized. We've seen health facility attendance increasing, and the health workers have been better trained to manage fever cases, and also to know when to refer patients if they suspect COVID-19.
I have so many questions for you, because I mean, you're the national coordinator of Nigeria's National Malaria Elimination Program, and a lot of us are very concerned about, what sort of measures are being taken. We were talking earlier on the show about 2025 being the goal across the world for a malaria-free world. How far away are we from that in Nigeria?
Well, actually, the WHO, the World Health Organization Global Technical Strategy, had set 2030 as the target to have at least 90% of the countries eliminating malaria by 2030. That's according to WHO Global Technical Strategy. And we in Nigeria are hoping that we will be one of the countries that will achieve that milestone by 2030. In terms of where we are in Nigeria, so far we have seen a steady decline in the prevalence of malaria in the country. Some states are doing far better than others. For example, in Lagos State, the last survey we did, the national survey, found that the prevalence of malaria in Lagos State was less than 2%, whereas in other states, they're up to 50-something percent. So states are at different level of reducing the burden of malaria in the country. That apart, Nigeria, like the other guest mentioned, tops the list of the country with the highest burden of malaria globally. So like he mentioned in the 2020 World Malaria Report, Nigeria accounted for 27% of the cases, which translated to about 61 million cases in a year, and the deaths were about 23% of the global deaths, which was about 409,000. And Nigeria, so that translates to about 90,000 deaths a year, compared, for instance, to COVID-19. So far in a year where we've had it, we've recorded about 2,600 thereabout deaths. Okay. So Nigeria, malaria kills more people, far more people than COVID has done in the year. So right, we are not where we want to be, but we are making progress. So in the last 10 years, we've seen a decline from 42% prevalence in 2010 to 23% prevalence, that's nationally, in 2018. So that's how far we have come.
I'll come back to you, but we're joined now in the studio by Dr. Ola Brown, who's the founder of Flying Doctors Nigeria. Thank you so much for being here today.
Thank you.
Always good to see you. I want to talk about a myth, but if it's a fact. You know, there's people who believe that malaria can never be eradicated in these parts because they believe it's a tropical disease. We are in the tropics. It will always be with us. And how that affects people's attitude to malaria, like I asked her earlier, where people in Nigeria suddenly think malaria is, we will always recover from it. People just self-medicate. Malaria is not taken as seriously, even though, like she said, it still kills thousands and thousands of people every year.
So malaria is actually one of the biggest killers in the world. And what people don't realize is malaria has shaped some of the major global events that have happened in the world. So malaria was actually the first parasite to be used as a tool of war. In Rome, they actually drained all the swamps in Rome at one point when they were at war to stop the Germans getting in. And the Germans went to go and fill it back up again so that everybody would catch malaria. Malaria has been used as a tool of bioterrorism before, and it shaped a lot of global events. For example, when slaves were going to America, West African slaves actually had a gene. We still have a gene that gives us some degree of resistance to malaria. And because of that, African slaves, especially from West Africa, were not dying on the plantation. So they said that this is a great product. Like, these people are not dying as much as white people, as other people. So that's how they started really bringing, like, a lot of black slaves in, which obviously has affected, like, you know, it's related to the Black Lives Matter movement now in America. And it's affected Nigeria and our development and West African countries' development significantly.
So it is a big deal.
So malaria is one of the most aggressive, like mosquitoes, I guess, are probably the most aggressive predators that we share the earth with. We think about snakes, we think about lions, we think about tigers, but actually mosquitoes have been probably the most influential animals or insects in terms of our evolution and in terms of who won wars, in terms of who was enslaved, etc. But countries have been able to eradicate malaria. In fact, there was a big movement in the 70s of whole countries just spraying their entire country and eradicating malaria that way. And a lot of countries have done that. Unfortunately, the chemical that they used to eradicate malaria was quite dangerous, and it got into the food chain and may be linked to cancer. So it was banned for widespread use. But countries have affected malaria. Unfortunately, have eliminated malaria. Unfortunately, countries that had malaria post-70s that didn't take that opportunity to eliminate it, now have to do the hard route. And the hard route is obviously, by surveillance, using bed nets, prevention, genomics. So Senegal has actually done quite well in terms of eliminating malaria. And then there's also hope for a COVID vaccine. So we're for a malaria vaccine. So people are talking about the COVID vaccine, and there's been all this, we have to buy vaccines, there's a vaccine appetite. And this is like the Nigerian typical issue, right? We always make other people's problems our problems. Our biggest problem that has, killed 100,000 people, over 100,000 people per year for as long as we can remember, for the past 200 years. So imagine, for the past 20 years at least, is malaria. And we should be focusing this new mRNA technology on taking ownership of the malaria vaccine, because that's something that COVID kills people that are older. Actually, the greatest mortality for malaria is in young people, it's in children. So our under 5 mortality is actually caused by malaria. And hundreds of thousands of kids across Africa die from malaria. So that's something that we should really be thinking about as we go into sort of discussions around vaccines, vaccine availability and vaccine production in Africa.
We're going to take a quick break now. When we come back, we're going to continue this conversation. We also have some other guests joining us as we discuss all the issues around malaria on World Malaria Day. Please stay with us. All right, welcome back. We're discussing malaria. World Malaria Day is around, and I want to go to one of our guests via Skype. Lilis Njanga, if you can hear me, is the Africa Director at Malaria No More UK. How are you doing, Lilis? Can you hear me? Okay, while we try to get that reconnection, we also have another guest, a public health practitioner, Dr. Akbaku Kalu. How are you doing, sir? Hello, sir. Okay. I think we have a freeze frame. We'll come back to our guests in a minute. But let me still stick with you now, Dr. Ola Brown. I want to know this vaccine conversation, because I saw something online about, I think a day or two ago, about almost, whether, I'm not sure whether it's ready now or whether it's been approved, but it was very exciting news.
Absolutely.
And it made me believe, okay, this 2025 or 2030 goal might be realistic after all. Is that something that we should be consciously working at, getting, especially in these parts?
I think.
And how soon do you think?
I think the results that I've read from the clinical trials are quite promising. The vaccine was tried on children, I think again in Senegal. And, there's been malaria vaccines over the years, but none of them have showed good efficacy. But this one, because of this new mRNA technology, so the old vaccines, it was actually like a slightly modified virus that they were injecting into people. But this mRNA technique works in a slightly different, more efficient way. So because of this technology that was originally developed for COVID, we've seen new research come out of that in terms of applications to malaria. And I think that gives us a bit of hope. And I think that it's up to scientists, public health physicians, healthcare investors to now look at how we're going to be able to harness the funding for much wider clinical trials, take ownership of the vaccine as much as possible so we can produce it in country. Because why was the COVID vaccine developed in 1 year and it's taken like 20, 30 years for the malaria vaccine? It's because we don't have money. And we don't have production capacity and we don't have the research capacity. But now the initial research has been done. I think, Africans need to work together to bring this malaria vaccine to production in a cost-effective way. Okay,
I think we have Ladies Njanga now, who's Africa Director at Malaria No More UK. I was just going to ask, Africa as a whole, Nigeria, unfortunately, does carry the heavy burden of the numbers and the number of deaths as well. But on an Africa sort of perspective, is this fight looking surmountable in the next, say, decade?
Thank you very much for having me. Yes, let me start by saying that we've made quite some good progress the last 20 years, but unfortunately the last few years have seen us sort of stagnate because between 2000 and up to close to 2019, we saw a 2/3 reduction in Africa. We saw over 7 million lives being saved and over 1 billion cases being averted. But unfortunately, there seem to have been a stagnation, and we continue to bear, as you know, the biggest burden. And 94% of the cases being in Africa, that's almost looking at Africa as being the bearer of this burden. And it's stretching really our already fragile health system to a very big extent. And I always like to say this is not just a health issue. Malaria is more than a health issue. It is also a socio-economic issue, given that we lose about 12 billion USD annually in Africa. But yet again, if we continue with the pace that we began in the early 2000s and move on and do not stagnate, I think we can get to that goal of eradicating malaria from the face of Africa. If we were able to get down by 2/3 in the early years of this millennium, I think if we continue with that, we will get there. And if the vaccines that are currently showing some high level of efficacy, I think we'll get there faster. So in a decade, we can get there.
All right, I'll come back to you, but let me go quickly now to Dr. Akwaku Kalu, who's a public health practitioner and an expert in tropical and vector-borne diseases. Dr. Kalu, a lot of us got introduced to the words mutation a lot in the last year with COVID. And we know that also happens with malaria, which is why we keep seeing new medication come out. Oh, this was effective 10 years ago. These days, it has to be a new one because malaria is now sort of stronger, for want of a better word, than the medication. How does that affect, this whole drive to eradicate malaria, especially with the talk of vaccines now coming in? Is this something that looks possible?
Thank you very much. And thank you for this session on World Malaria Day. Africa faces 4 threats from biological sources against the vision of a malaria-free future. One of them is resistance of insecticides, of vectors to existing insecticides. That makes our nets or the spraying indoors that is used as strategy for malaria control very difficult, because if the insecticides are resistant, then it means that they will no longer harm the mosquito. And the mosquito, of course, will have a field day transmitting malaria. Then there is the other one, the medicine. The recommended medicine for malaria treatment in Africa is the artemisinin combination therapy. And that artemisinin itself has been known over the last decade for the parasite to have resistance against that very molecule, especially in Asia. Now, of course, we are monitoring it in Africa to make sure that it doesn't happen, and if it happens, that it is contained so that it does not undermine the treatment of those who have malaria. Recently, you might have seen the publication. There is evidence of genetic markers of that resistance in Rwanda. Of course, we've alerted all the countries that are malaria endemic in Africa, telling them this is happening, monitor it closely. And then, of course, there's a plan to ensure that it's contained. It is not yet affecting treatment outcome. Therefore, so to say, there is no resistance against the recommended treatment in Africa. But we are monitoring the situation closely because it's an evolving situation. And then you have the invasion of Anopheles diffensi, a type of vector in the Horn of Africa, meaning Eritrea, around Ethiopia, Eritrea, and other countries surrounding them. And these can easily spread. Now, that Anopheles diffensi is known to cause urban malaria, and it's not indigenous to Africa. So now it's been isolated, and if we allow it to spread to other countries, it could cause massive malaria outbreaks. Imagine that vector being in Lagos, with its estimated 20 million people there, who are probably naive of malaria. They have no immunity against malaria, and malaria happens because of a new efficient vector in Lagos. It will be disastrous. So that is another threat facing the malaria control situation in Africa. So all these threats need to be identified, need to be monitored, we need to manage it. And this is what we're talking about. If these threats are there, then we have a problem. It means our tools are no longer effective. Yes, we are thankful for malaria vaccines, the RTSS vaccine that's currently being piloted in Ghana, in Kenya, and in Malawi. And then the one that came out last week, that's the A21 that's been written about. These are tools that are welcome, and hopefully, vaccine will be a tool in addition to other tools. The vaccine will not be exclusive. It will not be the only tool. Malaria is a disease we are fighting with multiple tools. We are fighting with nets, we are fighting with medicines. Now, if vaccines become available, we will fight with vaccines. The combination of these tools will make a lot of difference.
Okay. I'll come back to you now. Dr. Ola, it's listening to that for the layman, it looks like the problem is much more complex than we thought or than we think it is. You know, there's vectors, there's all of these words being thrown around, which obviously shows that, you know, there are multiple threats with a disease that people take for granted, which is why I want to go back to that. Are you hopeful? Because I had spoken with the initial guest who was saying, well, at least we'll have like a 2-decade fight in our hands at least, and that involves us doing the right thing. Is that an overprojection or another projection in your view?
I mean, I don't have a crystal ball, but what I do know is that resistance is a problem. And what he was speaking about, actually, we've known for a long time, which is Dr. Kalu was saying that there are different forms of resistance. And I mean, even in your houses, you know, sometimes you spray Baygon and it doesn't work.
You usually walk in and the guy just flies past again.
They're still flying around. So we know that. I mean, even the lay people on the street know that there's some degree of resistance. But I think we're getting better at public health in Africa. I think that there's more consciousness amongst African leaders about the importance of health. And I think, you know, COVID-19 has been horrible, but one sort of silver lining is that the African political leaders and policymakers who used to kind of shove health under the carpet and think, you know, it's about building cement factories and building milk factories, they've now realized that, you know, they've realized the huge sort of relationship between healthcare and economic growth. And the reason why I'm optimistic is I think African leaders are aligned in terms of, the need to improve our healthcare, in terms of the need to focus on healthcare policy and the need to listen to the science. And they're also ready to invest. I think that the combination of scientists coming back to Africa, the combination of the innovation and the money that has gone into medical research in all areas in looking for a COVID-19 vaccine, and the general awareness now of the importance of health to the economy, I think gives us a good chance of putting up a stronger fight against malaria, for probably the strongest sort of most aggressive fight that we've seen in Africa in the past few decades.
Okay, let me just get a final word now from Abuja with Dr. Perpetua, who's the national coordinator of the National Malaria Elimination Program. And just talk about, like she's mentioned there, Nigeria is not in isolation. We're bordered by numerous African countries, and it's an Africa problem. Is that one of the strategies you're looking at, and how optimistic are you of this fight being surmounted as quickly as you can, please?
Yes, so we are looking in Nigeria, we are looking at different tools in fighting malaria also. Talking about resistance, for instance, we are beginning to deploy tools for the insecticide, for the nets, for the treated nets, and for the spraying of the houses that are not resistant. So new tools are coming out for the nets, for instance. There are next generation nets that are being deployed now, and then we have what we call the PBO nets that have additional chemicals to withstand the resistance that the vectors, the mosquito vectors are having against the pyrethroid only nets. So we are now working with new tools to ensure that we combat the effect of the resistance to the insecticide that are being used either for the nets or for spraying houses. Additionally, we are also looking at different strategies, combination of strategies. We know that one size doesn't fit all. In terms of, like I mentioned earlier, different states are different levels of prevalence and elimination. So we are packaging interventions. Recently, we developed a new malaria strategic plan that use data at local government levels to help us to know what the situation, peculiarities at different states, for instance, so that we can tailor interventions according to those peculiarities of the state. So we know, for instance, where people are not using nets, and then we look for other strategies to use.
All right.
Other preventive strategies that have been mentioned about environmental management, environmental sanitation, and other strategies. Then we have the seasonal malaria chemo prevention. This is being done also as a cross-border collaboration with other countries. We know that countries in the Sahelan region of West Africa all have similar rainfall patterns, and there's a tool that is deployed to those to combat malaria in children under 5. For us in Nigeria, in some countries they even extend it to children under the age of 10, and this is given as a prophylactic to those children during that peak malaria transmission season four times a year, to protect them from having severe malaria and death from malaria. And there are cross-border collaboration going on between Nigeria and other countries looking at this seasonal malaria chemo prevention. So we know definitely that eliminating malaria from Africa would not be an isolated thing by countries. We all need, the different countries need to work together using this kind of intervention, this strategy of cross-border collaboration to be able to achieve that, and using a package of different interventions that will work. Depends on the peculiarities of each area.
Thank you very much, Dr. Perpetua. Just a quick final word now from Lily Njanga, who joined us, of course, from Kenya. And I just want to talk about poverty. And it's impossible to talk about malaria and not talk about poverty, especially in Africa, because there's almost a direct link with it. We talked a lot about the sorts of housings we have, environments where there's refuse literally around people's homes. Is it possible to talk about eliminating malaria without eliminating poverty, and how can we do that?
Thank you very much. It's almost usually like a chicken and egg situation because each tends to push the other ahead, because we see a lot of poor households are already spending about a quarter of their family income on malaria, or out of loss, are losing their income because of not getting to work. So it's usually more of a chicken and egg situation. But if we are protecting these families, if these families can be able to sort of have malaria out of the way, we would see their children in these homes having much more potential in terms of no lost school days. We would see the adults in that home being able to go to work. Would see the adults in that home not losing their income. So I think the first point that we need to look at, I see like eradicating malaria really propels our fight against poverty. But if we can't win the war against malaria, we cannot expect to win the war against poverty. So we have to start at a point where we see that these two have to be tackled together.
Thank you very much. That's a great way to end it. Thank you very much, Lily Njanga, Dr. Carlo, Dr. Perpetua, and of course, Dr. Ola Brown for joining me and educating me. Definitely learns a lot today. We're going to be coming back with a talk on fashion for a good cause in just a moment. Please stay with us.